Good morning to all. A very warm good morning to all the distinguished resource person, faculties, and dear delegates. Myself, Ms. Debina Devi, Faculty OBG Department RVCN, feels honored and privileged having an opportunity to be the host for today's webinar, and it gives me an immense pleasure to extend a hearty welcome to you all on behalf of RVCN fraternity. We appreciate you all for taking time off your busy schedule and joining us today. Dear delegates, as we are about to begin the webinar, all the delegates are requested to keep their camera off and microphones muted to avoid unwanted disturbances. If you have questions, you can use the chat box to drop in your queries. I request you please switch off your speaker. If you have any questions, you can use the chat box to drop in your queries and the speaker will answer to it. Request for your kind cooperation. Sexual and Reproductive Health Day is observed every year on February 12th across the world, aimed at promoting and educating people about the importance of sexual and reproductive health. With the rise of sexually transmitted diseases, infertility, and sexual health related issues, it has become essential to encourage individuals to take control of their fertility health. Reproductive rights are also an important aspect of reproductive health and well being. Ensuring access to safe and legal abortion services, the right to choose their preferred method of family planning and contraception, and protection of reproductive rights is crucial for individuals to make informed decisions about their reproductive health. Sexual and Reproductive Health Awareness Day is a significant reminder of the importance of reproductive health as an integral aspect of overall and well being. So let us all embrace this day and make a commitment to prioritize and improve our sexual and reproductive health as well as the health of those around us. Without further ado, we must now begin the session. The power of gathering, it inspires us delightfully to be more hopeful, more joyful, more thoughtful in the world, more alive. I now request Mrs. Gautami, Assistant Professor, Pediatric Department, RVCN, to welcome the beautiful gathering with a sweet aroma of happiness through the words of welcome.
Thank you, Ms. Debina. Very pleasant morning to one and all. Coming together is a beginning. Keeping together is a progress. Working together is a success. I, Mrs. Gautami, Assistant Professor Pediatric Department, take this privilege in welcoming each and everyone to this webinar on behalf of RVCN. At the outset, first I would like to extend my hearty welcome to Dr. H.S. Chandrika, gynecologist and obstetrician, Chirag Hospital, Bengaluru, the resource person for today's webinar. We are extremely delighted to have such an eminent and dynamic personality amongst us today as eminent speaker. On behalf of RVCN, we wholeheartedly welcome you, ma'am. Next, I would like to acknowledge my amiable welcome to Dr. Charu Valikana, Doctorate in Law, LLM, MA Sociology, Women's Rights Lawyer, New Delhi for today's webinar. We are extremely delighted to have such an renowned person amongst us as resource person. On behalf of RVCN, we welcome you, ma'am, wholeheartedly. Next, I extend my cordial welcome to Dr. S.R. Gajendra Singh, Organizing Chairperson, Principal RVCN, for his enthusiastic support, encouragement, and guidance in organizing this webinar. On behalf of RVCN, we welcome you, sir. Next, I would like to acknowledge my warm greetings to all the HODs of various departments, faculties from various educational institutions, and staff of RVCN for their presence in this event and their support throughout. On behalf of RVCN, we welcome you all. Lastly, my heartfelt and warm welcome to all the delegates for their presence amidst us and joining us this webinar in spite of your busy schedules. Welcome you all once again for this program. Raise your standards to create the change. Have a good day. Thank you all.
At the foresight, it is my great privilege and pleasure to welcome Mrs. Sheila J., HOD Department of Obstetrics and Gynecology, RVCN, to deliver the inaugural address to the gathering.
A very good morning to one and all. February 12th marks the annual Sexual and Reproductive Health Awareness Day, an opportunity to raise awareness about sexual and reproductive health and rights, as well as educate about family planning, contraceptive choice, and how to reduce the spread of sexually transmitted infections. UNFPA, the United Nations Sexual and Reproductive Health Agency, views good sexual and reproductive health as a state of complete physical, mental, and social well being relating to reproductive system. This implies people as are able to have a satisfying and safe sex life, the capability to reproduce, and the freedom to decide if and when, how often to do so. Sexual health is a broad area that encompasses many interrelated challenges and problems. Key issues and concerns are human rights related to sexual health, sexual pleasure, eroticism, and sexual satisfaction, diseases, violence, female genital mutilation, sexual dysfunction, and mental health related to sexual health. Sex is a taboo in India. Due to lack of sex education, most people do not have adequate knowledge about healthy and correct sexual practices. A large ratio of females fall victim of child marriage or underage marriage. Lack of maturity and knowledge of sexual practices and contraception add to arising problems. Women often get pregnant without prior planning. It is thus clear that a lack of knowledge about sexual and reproductive health is the primary reason causing a lack of family planning in the country. Talking about sexual issues has always been a problem. The National Population Stabilization Fund, that is Janasankhya Sthirata Kosh, has started a helpline to provide confidential counseling services and immediate answers to queries on sexual and reproductive health problems. Many of us are not aware of this. So, awareness programs like this will ward off the ignorance on sexual and reproductive health and enable the people to enjoy a better future. I once again welcome all the delegates here and also the resource person who are going to take us through the sessions. And I hope all of you will have a happy learning. Thank you.
Thank you, Sheila ma'am. I now request Mrs. Navita, HOD Department of Mental Health Nursing, RVCN, to introduce the renowned speaker, Dr. H.S. Chandrika, to our esteemed audience. Over to you, ma'am.
Good morning, one and all present here. Dr. H.S. Chandrika is an experienced gynecologist in Chirag Hospital, JP Nagar, Bangalore, and a consultant gynecologist at Dr. Malati Manipal Hospital, Jayanagar, Bangalore. Dr. H.S. Chandrika has many years of experience as gynecologist and obstetrician. Ma'am is one of the best IVF specialists and offers a number of medical services, including amniocentesis, artificial insemination, cervical clearage, gynec problems, natural cycle IVF, and many more. Ma'am is an expert in prenatal care, pregnancy management, and treatment of women's reproductive conditions. Ma'am also helps in providing preventive care, pap test screening, and detection of sexually transmitted diseases. Ma'am completed MBBS from Bangalore Medical College and Research Institute in the year 1982 and DGO from Bangalore Medical College and Research Institute in the year 1994. Ma'am has memberships in Bangalore Society of Obstetrics and Gynecology, Federation of Obstetrics and Gynecology, Society of India, Ma'am's professional approach is very considerate, individualistic, and customized depending on different cases and their problems. Thank you, ma'am. We are pleased to have you as a speaker here. Over to you, ma'am.
Okay, thank you. Thank you for that nice introduction, ma'am. I again tell good morning to all my colleagues here from the RV College of Nursing and also the students of RV College of Nursing. This occasion has been due because of the Sexual and Reproductive Health Day that was on 12th of February. And it being a Sunday, the college has made it available on the Monday of the week because people can attend it more easily. So at the outset, I thank RV College of Nursing for giving me this opportunity to address you all on the topic of sexual and reproductive health. I have a few slides here, and I'm hoping that you all can hear me. So in between the slides, I'll talk a little bit about the slides. Yeah, reproductive health. Reproductive health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matters related to the reproductive system and to its function. Sexual health. Sexual health means having a responsible, satisfying, and safe sex life that is free from disease, injury, violence, disability, and unnecessary pain or risk of death. Sexual reproductive health was given an international consensus definition at the International Conference on Population and Development in 1994. We have come a very long way from 1994 to today, that is 2023. Why do we need to know about this? Having access to sexual and reproductive health and rights can decrease the child marriage, decrease teenage pregnancies, and prevent transmission of sexually transmitted infections. As you all know, if there is child marriage, the girl is not at all mature enough to understand life. And at that age, if you are forcefully marrying her, she'll not be able to take the challenges of routine life itself. And taking the challenge of a married life, it's even more beyond her reach. So we should avoid child marriage. We should decrease the teenage pregnancies. Most important thing, what I would tell to all of you, my nursing students, is that you're all young girls, and at that age, it is infatuation which takes over your senses, and so you tend to have affairs with your whomever you see. So you have to always try to avoid those infatuating relationships. So when you want to have any physical relationship with anybody, you have to always think of the consequences that is happening with the female. It is not the male who suffers. It is more often the physical suffering of the females if they have to if they give response to every infatuation that you face in your life. And you have that one more thing is because of that we can prevent unnecessary teenage pregnancies, and we can also prevent transmission of sexually transmitted diseases. So most important thing about this I would tell is at the very young age, if you are infatuated with some male person, and if you easily go and have a physical relationship with him, then you will have multiple partners. Means whenever you are infatuated, if you start having relationships, you will be exposed to multiple number of partners. And when a young girl or a young lady is exposed to multiple number of partners, that is the time when most of the dangerous things about sex happens. That is, they will be exposed to unwanted different type of people and varied number of infections that can happen in any of these men. So always you have to be always very careful when you are going to a physical relationship with a known person to you, because you have to use the pros and cons. You have to think over before going into it. So that is my advice to you all youngsters. SRH or sexual and reproductive health implies a wide range of health issues, including family planning, maternal and newborn health care, prevention, diagnosis, and treatment of sexually transmitted infections, including HIV, adolescent sexual reproductive health, cervical cancer screening, infertility prevention and management. At the outset, what I wanted to tell you in the beginning itself to my dear nursing students is that you are the young females in between the medical fraternity and the social public. That is, the public, when they see you in your this thing, when you see in your nursing uniform, they have a very much big regards for you. They respect you, and you have to take over that along with you, because when they have respected you, you have to know some things about the medical field, and you have to advise them, because you are the ones who are in between the doctors and the general public. So you have to know a little bit about all these things, so that when they come to you, you can also give them sufficient advice, because always the general public respects your uniform, and they always readily accept whatever you tell. So it feels more on your this thing to have responsible knowledge of all these things, so that you can be a link between the doctor and the general public. So what is this thing is, in sexual reproductive health, we always try to avoid complication of sexually transmitted infections, sexual violence, women dying from avoidable cancer. When we come to the sexual violence, when we see the newspapers today, when you open the newspapers today, the most common thing that we see is every day there is a rape everywhere. The reason for that is, I feel the men in today's society are too much erotic, and whenever they see any female, they immediately have the feeling of many of the men, not all men, and that is the reason amount of rapes have become so much, and they are so violent that they don't mind attacking any age people, in very young children. They are raping very young children, and I think we have to understand these things. And because we cannot tell them anything, so as females, you must all be careful about yourself when you are exposed to this type of general society. So sexual violence is one thing where we should not be very comfortable with anybody that you see. Okay, so we will always be careful from your side also. And there are women dying from avoidable cancer. That is also what we see. Is what I tell you. That's what I tell you. You should not have multiple partners. Multiple partners is one thing wherein you don't know with who, what infection you are exposed to. So avoidable cancer is that cervical cancer. Cervical cancer is one of the common cancers in our Indian population. So this happens due to a particular viral infection of the cervix, and that is more common in people who have multiple partners. So that is due to human papilloma virus. So when people are dying from avoidable cancer, that is one of the things is cervical cancer. So to avoid that also is one of the aims of sexual and reproductive health topic. So components of sexual and reproductive health. One is sexually transmitted diseases and its prevention and management. So when we come to sexually transmitted diseases, common disease is syphilis, then gonorrhea, then HIV and HPV infection. These are common sexually transmitted diseases. And one more thing is this syphilis. Syphilis was very much more in our student days, because we used to see more of syphilis in our routine OPDs. But I feel the routine amount of cases of syphilis and those things have reduced. But one more thing, what I talk is about the society that I see. That is, the society that I see is a little higher up. Means they are not in the lower strata of society. So that may be the reason that I am not seeing so many of these diseases. But when we go to the general population, when we go to the government patients, the number of sexually transmitted diseases are definitely more. And nowadays, you all know that there is HIV or AIDS. And this HIV or AIDS, the government of India and the government of Karnataka, they have made so many measures to tackle this. And they are having a separate wing for HIV or AIDS in the Vani Vilas department hospital, and they have a different set of doctors who handle with them, and they also provide you free medicines, and they give you proper advice. So if you have any of those doubts, you can meet any of them, or you can meet any of us also private practitioners if you have any doubt, so that we can clarify those things to you. Next is prevention and management of unsafe abortion. See,
Excuse me, ma'am.
girls, when you go to have affair,
Chandrika, ma'am.
yeah,
Ma'am, your slides are not moving. It has been stuck with the first slide itself.
I am talking with that same slide. I'm
Okay,
continuing.
okay, okay, okay.
Yeah. Prevention and
Okay.
management of unsafe abortions. See, when you young girls unwantedly suddenly you have some affair with anybody, and if you are not careful about preventing yourself from becoming pregnant, you may end in a pregnancy which you do not want to continue. That is called as unwanted pregnancies. And if there is an unwanted pregnancy, naturally you want to abort the pregnancy. And if you go to every Tom, Dick, and Harry that you see, and you get try to get your pregnancy terminated, what is called as abortion. If it is done at an unsafe place by an unsafe person who is not an educated person, who is not a qualified person, then it is called as an unsafe abortion. So I would like to advise you all to not to go for some unsafe abortions. If at all you have any unwanted pregnancy, you please meet a qualified gynecologist who will try to guide you with that and try to make you have a safe abortions. By avoiding unsafe abortions, you are avoiding so many dangers and even danger of life itself. You may lose your life also if you have an unsafe abortion. Next thing is prevention of gender-based violence. So anything when you are exposed to the general population, you have to be always careful about the other gender because you have to be having that in your mentality by seeing the society. You have to be able to read from your this thing that whether that person is a proper person. So that way you have to keep yourself safe from such people. So that is the way that you should not be very freely mingling with everybody. And next thing is prevention of harmful practices. Prevention of harmful practices is that is meant for the doctors also. It is meant for the nurses also. When you know that it is unsafe thing, you better advise your people not to go for such harmful practices. Next is prevention and management of infertility. See, infertility also, some of the causes are due to, routinely it is due to some maternal injury, maybe some dangerous infections which may permanently damage the female reproductive system and make them unable to conceive later. I have seen this happen in the present Bangalore itself because some educated person has gone to an uneducated nursing staff to get her pregnancy terminated. And it has happened in South Bangalore only. And she has done it in such a dangerous way that her whole reproductive system has been permanently damaged. And now she has become permanently infertile. And she is not able to be coming out of that infertility problem. Next thing is family planning. Family planning is family family planning. What is the meaning of that? Is you have to plan your pregnancy in such a way that when it is wanted, you have to have your pregnancy. That is when you have a relationship, when you're a husband and wife with a particular this thing. So when you have to have the child, you have to plan when to have the child. What is your physical status? What is your financial status? And all those things, and plan and then have the pregnancy. That is when you have the pregnancy, you have to plan. So when you want to do proper family planning, it is better you just attend to your family doctor, that is an obstetrician or a gynecologist, and just go and tell her that you're planning for a family. Then she'll give you what are all the things that you have to see. Means what are all the tests you have to undergo, what are all the medical examinations, that is blood tests and all, and what are all the things that you have to be careful about before you plan for a pregnancy, and what is the precautions that you take, what are the things supplements that you have to have before having a plan to conceive. The next thing is prevention of maternal and perinatal mortality and morbidity. This also comes along with the carefulness of how you become pregnant. So when you have planned pregnancy, you will go to a proper place where you will deliver. And also after delivery, you'll be looked after properly by the particular hospital and the staff there, as also the obstetrician, so that you will not land any problem and any problems post delivery. So next is sexually transmitted diseases. What are sexually transmitted diseases? Sexually transmitted diseases or sexually transmitted infections are infections that are passed from one person to another through sexual contact. The contact is usually vaginal, oral, or anal sex, but sometimes they can spread through other intimate physical contacts too. This is because some STDs or sexually transmitted diseases like herpes and HPV virus are spread by skin to skin contact also, because there is any cuts on your skin surface, from those surfaces also these infections can spread. So you have to be careful about all these factors. Unless you know about this, you will not be careful. So that is the reason I'm trying to educate you. There are more than 20 types of sexually transmitted diseases, including chlamydia, genital herpes, gonorrhea, HIV or AIDS, HPV, syphilis, and trichomonas. What causes sexually transmitted diseases? Sexually transmitted diseases can be caused by bacteria, viruses, and parasites. Who is affected by sexually transmitted disease? Most STDs or sexually transmitted disease affect both men and women, but in many cases, the health problems may they cause can be more severe in women. If a pregnant woman has an STD, it can cause serious health problems for the baby. So what I told you that STDs can affect both men and women. So when it affects men, the men go off, pass off easily, means they don't suffer so much. But it is the women who suffer so much. Right from the initial symptoms, they suffer more. And second thing, suppose they land in unwanted pregnancy because of this sexual activity, then if they get this sexually transmitted disease, not only the particular baby is exposed to it, again the baby in the womb, that is also exposed to the sexually transmitted disease. So you have to be very careful about all these things when you are having any sexual activity. If there are symptoms, they could include unusual vaginal discharge or discharge from the penis, sores or warts on the genital area. See, what I have seen when I was a student, where I have done my studentship in Vanivilas Hospital. Right in Vanivilas Hospital, we used to see huge genital warts coming from the perineal area in those days. But I don't know how is the situation in the government population, but in the advanced society, we do not see such big warts here. And what we see is very small little warts we routinely see in today's society also. The reason for that is they have been exposed somewhere, but otherwise the viral exposure cannot happen. The next thing is painful or frequent urination. What I see in my outpatient department, every other day there are plenty of people coming with urinary infection. Urinary infection is also in a way transmitted sexually. But because it is transmitted sexually, I cannot tell that you should not have sexual activity at all. So painful or frequent urination is also one of the symptoms. Next thing is, so whenever a person comes with history of urinary infection, I don't take it for granted that it is urinary infection. I always try to examine the lady internally to look for any other symptoms in the vagina or the uterus so that I can catch some other infection along with the urinary infection. Itching and redness in the genital area is another one symptom. Abnormal vaginal odor also. So many times the patient comes with a history of vaginal odor, which is very bad. That gets an indication that we have to investigate what is the cause of that odor. So most of the times it is due to some sexually transmitted diseases. Next thing is anal itching, soreness or bleeding. So anal itching, they can go to a general practitioner also. So all of you handling the medical, who are all in medical profession, medical field, should know about all these symptoms so that they can guide them to the proper doctor where they have to see their problems. So anal itching, soreness and bleeding can happen. Next thing is abdominal pain. Abdominal pain can happen because you will have got infection from the partner, and that infection will be ascended up to the upper parts of the genital system. That is the uterus and the ovaries. Next is one of the commonest symptom is fever. So, how are sexually transmitted diseases diagnosed? If you are sexually active, you should talk to your healthcare provider about your risk for STDs and whether you need to be tested. This is especially important since many STDs do not usually cause symptoms. Some STDs may be diagnosed during physical examination, as I told you, or through microscopic examination. So, when I see any odd discharge in the vagina, we have to send that particular vaginal discharge to the laboratory to be assessed. So, from the microscopic examination, they can find out the cause of that particular infection. Most common of this is gonorrhea. And the next thing is any sore or fluid that is spat from the vagina or from the penis or from the anus can lead you to the diagnosis. Blood tests can diagnose other types of STDs, example syphilis, etc. What are the treatments for sexually transmitted diseases? STDs. Antibiotics can treat sexually transmitted diseases that is caused by bacteria. There are some parasitic infections too, that is treponema, etc. So those things, anti-parasitic treatment can be given. There is no cure for STDs caused by viruses, but medicines can often help in the alleviating the symptoms and lower your risk of spreading the infections. So this you have to know. You should not keep quiet that anyway I'm having this viral infection, that is HIV, etc. You have to go to your doctor so So they'll treat you with antiretroviral treatment so that you'll become more, you'll lessen the chances of spreading the infection further. So that is the reason you have to go to your concerned doctor. Correct usage of latex condoms greatly reduces, but does not completely eliminate. As you all know, these latex condoms also they have micropores, and that is the reason so many times people who have used condoms also will have accidentally unwanted pregnancies. So any of these things, if you have used also, you should not just assume that you will not conceive and you will not have any sexually transmitted diseases. The risk of catching or spreading sexually transmitted diseases is lessened by using these condoms, but it is not 100% avoided. The most reliable way to avoid infection is to avoid any anal, vaginal, or oral sex. There are vaccines to prevent HPV and hepatitis B, and that is easily available in all of your practitioners, all of your doctors that you are going to. So please, all of you, as nursing students also, I recommend all of you should go and take that HPV vaccine and hepatitis B vaccine. And that way you're going to prevent so many things. See, HPV vaccine, by taking that one, you're going to prevent HPV infection, which is the cause for cervical cancer. And hepatitis B vaccine, by taking hepatitis B vaccine, you're going to avoid hepatic carcinoma, that is liver carcinoma. So that is the way you have to do preventive medicine. So please, all of you care to know about these vaccines, please meet your doctors and please go and take those vaccines. That is my advice to you. Can sexually transmitted disease, STDs, be prevented? Correct usage of latex condoms greatly reduces but does not completely eliminate the risk of catching or spreading STDs. If you or your partner is allergic to latex condoms, you can use polyurethane condoms. Most reliable way to avoid infection is not to have anal, vaginal, or oral sex. But this is not a practical thing in today's life. So always when you have these things, back of your mind, you please keep in mind that these are all the things that can happen. So that if you have any problem, you can meet your doctor concerned and they'll be able to guide you and find out if there is any problem. There are vaccines to prevent HPV and hepatitis B that I have already told you. Unsafe abortion, a procedure for terminating unwanted pregnancy, either by person lacking necessary skills or in an environment lacking the necessary skills or lacking medical standards. This is what I told you long back about one case that I have seen. It is the cause of serious complications and disability and is a prominent cause of maternal death. See, what can happen is unsafe abortions. There are quacks who are doing abortions. So they should just physically try to empty the uterus. When in the act of emptying the uterus, they can damage the uterus, they can perforate the uterus. And perforate the uterus is not just over there. When you perforate the uterus, your instrument goes to the general abdominal cavity where we have the bunch of intestines there, and the intestines gets damaged. Then when they are doing it in an improper setting, the natural thing is to get into infection. The infections will be so bad then that is not easily treatable by medicines, and they have to be admitted for several days in ICUs. So that is the reason when you are having an abortion which is unsafe, always try to be careful. Try not to go to people where there is no standard taken care of. So you have to be very careful when you are having abortion. Please meet your concerned obstetrician or gynecologist and you request her to reduce the rate of charges for abortion so that she may help you out like that and you may be landing in a safe abortion rather than going to some quacks who does it for very low price and you'll be sacrificing your life itself for that. So always be careful when you are going for any abortion procedure. They are a result of unmet need for family planning, because when family planning is not properly planned, you will naturally will end up in unwanted pregnancy. So that unwanted pregnancy will lead to unwanted abortion, which may go to unsafe places. Okay. Next thing is contraceptive failure. As I told you, this condoms also. So many of my patients, they have used condoms, they have used various method of contraception, but in spite of that, they have conceived. So that time, that is the reason for your pregnancy, and you better go to a proper doctor and get it terminated. The reason for that contraceptive failure is one thing is these latex condoms may have micropores, and micropores are enough for the sperms to travel across and cause pregnancy. Then next thing is lack of information about contraception. See about contraceptive failure, that is also one thing. See, when we take oral contraceptives, so many people they don't know that oral contraceptive has to be taken every day for it to be effective. That oral contraceptive acts by preventing ovulation. That is preventing ovulation, matlab there is no ovum present for the person to conceive. So that is one thing. And they don't know that it has to be taken every day regularly. The way it works, that oral contraceptive works is it has to be taken on a daily basis. Because if you don't take it properly, then ovulation cannot be prevented and hence unwanted pregnancy also cannot be prevented. Restricted access of safe abortion services. So as I told you, please always meet your doctor and go ahead when you're taking the choice of abortion. Please don't land up in unsafe abortion in unsafe places. Prevention is go for safe abortion and post-abortive care also. The doctor will be able to guide you what you have to do after abortion. Unsafe abortion. Next thing is about this unwanted problems about physical activity, physical relationship is infertility is a disease of the male or the female reproductive system defined by the failure to achieve pregnancy after 12 months of more or regular unprotected sexual intercourse. So anybody who comes to us, so they have not conceived, if they are newly married, if they are just been married for 2 to 3 months, we always advise them so that they can leave it, that naturally they'll conceive. There is no need for treatment for such couple to conceive. Okay, naturally only if they are having unprotected sex, means if they are not taking any contraceptive measures, naturally in over a period of few months they will naturally conceive and then they can go forward with their pregnancy. So if primary, there are two types of infertility. One is primary infertility. The primary infertility in a couple is a person where they have never had a child. Means at the outset, from the beginning, they have not been able to conceive. That is called as primary infertility. One more thing is secondary infertility. Secondary infertility is the failure to conceive following a previous pregnancy. See, so many people, they'll have become pregnant and they'll have aborted that pregnancy. So they'll not have a live child. So that is the reason they come for it. And so many times they are not able to conceive for the second time. That is also one that is called as secondary infertility. So secondary infertility, most commonly it can be due to the unwanted pregnancy which has caused infection. Infection has gone above and it has affected the tubes of the uh, tubes in the ovaries. So tubes, when it got slightly infected, it can get blocked. When there is blockage of the tube, there is the sperm and the egg cannot get transmitted across, and so they cannot meet each other, so they cannot conceive. That is one of the causes of secondary infertility. Specific treatment for infertility is IUI or intrauterine insemination. That is one of the simplest procedures in infertility. Next thing is in vitro fertilization. That is otherwise called as test tube baby. Here the pregnancy happens in the laboratory and then the pregnancy that happens and the embryo that is produced is then transmitted into the womb of the lady and it grows in the womb and it advances to the full term pregnancy and they are delivering it. Then next thing is in intracytoplasmic sperm injection, ICSI. That is also a type of treatment for infertility. In these cases, this is happening in patients who have male factor and there is some problem with the semen. In those cases, when the semen or the sperms are very weak, then the infertility specialist tries to take the sperm and tries to inject it into the cytoplasm of the ovaries, and that way they conceive and they produce an embryo. This is called as intracytoplasmic sperm injection. These are the treatments for infertility. Family planning. Family planning is to regulate the number and spacing of the children in a family through the practice of contraception or other methods of birth control. So, what is the importance of family planning? As I told you, whenever you want to have the baby only, you have to plan and then conceive. That is the best way of running your family. So, suppose you have one child, then you should know that when to have your next child. So, suppose nowadays people are having too many cesarean sections. So when there is a cesarean scar on the uterus, it is better not to expose that uterus for a pregnancy immediately. Because as you know, when there is a pregnancy, the uterus grows enormously. And when it stretches like a balloon. So there is a scar on the uterus. And when there is a scar on the uterus, if it goes to that extent of stretching, it may give way and they may land in problem, that is the rupture of uterus. So that is the reason the doctors will have told you that there should be a need of family spacing. That is, after one child, you have to leave particular amount of gap between the first child and the second child. Usually, it is better to have at least 3 to 5 years gap in patients who have undergone cesarean section before you embark into another pregnancy. Then there are so many other methods of family planning also. So that also you can it can be to avoid unwanted pregnancy, to regulate the timing of pregnancy. That's what I was talking about in my previous slide. And to regulate the interval between pregnancies. So methods of contraception. What are the methods of contraception? One is temporary method, other is the permanent method. So when you want to have contraception, you have to decide whether you're done with the pregnant with the amount of children that you have. Otherwise, or if you
under 18. So this exception, the Supreme Court held, carved out of the IPC, creates an unnecessary and artificial distinction between a married girl and a unmarried girl child, and has no rational access. Its objective is clear, and they said that this is illegal. The third is, I think you all are aware of it, 6 September 2018, the Navtej Johar judgment, which decriminalized homosexuality. The Supreme Court held, carved out of the IPC, creates an unnecessary and artificial Supreme Court distinction between a married girl and an unmarried girl child, and has no rational access. Its objective is clear, and they said that this is illegal. And it is an important facet of their right. The third is, I think you all are aware of it, 6 September 2018, the Navtej, which is really Johar judgment, has this exception, the Supreme Court held, carved out of the IPC, creates an unnecessary and artificial Supreme Court distinction between a married girl and an unmarried girl child, and has no rational access. Its objective is clear, and they said that this is, and it is an important facet. The third is, I think you all are aware of it, 6 September 2018, the Navtej Johar, which is really Johar judgment, has this exception, the Supreme Court held, carved out of the IPC, creates an unnecessary and artificial Supreme Court distinction between a married girl and an unmarried girl child, and has no rational access. Its objective is clear, and they said that this is, and it is an important facet. The third is, I think you all are aware of it, 6 September 2018, the Navtej Johar, which is really Johar judgment, which this exception, the Supreme Court held, carved out of the IPC, creates an unnecessary and artificial Supreme Court distinction between a married girl and an unmarried girl child, and has no rational access. Its objective is clear, and they said that this is, and it is an important facet. The third is, I think you all are aware of it, 6 September 2018, the Navtej Johar, which is really Johar judgment, which this exception, the Supreme Court held, carved out of the IPC, creates an unnecessary and artificial Supreme Court distinction between a married girl and an unmarried girl child, and has no rational access. Its objective is clear, and they said that this is, and it is an important facet. The third is, I think you all are aware of it, 6 September 2018, the Navtej Johar, which is really Johar judgment, which this exception, the Supreme Court held, carved out